Welcome to the AMREP precinct. My name is Steve Jane. I'm head of the Central Clinical School, but I stand here really representing the partners who all work on the AMREP site, that include Baker IDI Institute, the Burnett Institute, the Alfred Hospital, Central Clinical School and the School of Public Health and Preventative Medicine. A number of years ago we decided that rather than having individual honours nights, we'd have a joint evening. And so there is a smorgasbord of research opportunities outside those doors, a range of rooms that have been set up for you all to go around and visit and meet with people who do the research on the precinct and hopefully convince you that this is a site that you'd like to come and do your honours and potentially higher degree research. Firstly, I just want to acknowledge there's been an enormous amount of work. I think we've had 320 RSVPs for the night. It's been rising exponentially each year. And that's predominantly due to a number of people within the school who've done an incredible amount of work. So I just acknowledge them, Rachel, Lisa, Kath, Julia and Vithya, who've been the main group who've done all the work, and they've had help from the other institutes. So thanks very much to all of those people. So, as I said, the point of the evening really is to try and convince you that your research career future lies on this precinct. I think there are a number of selling points, and I'll come to some of them later on, but probably the one that I think that you want to take away from here most readily is that this precinct prides itself on being one of the foremost translational research precincts in the country. And by that I mean we see that the distance between the research we do here and outcomes for patients is as small as it can possibly be. And that is underpinned by departments that are headed by some of the finest clinician scientists in the country with international reputations, and departments where the heads may not be clinicians, but their science is deeply entrenched within the clinical departments of the Alfred Hospital. And it's purely the proximity here that gives us this advantage. We sit here, the Alfred literally right next door, and that provides us access to patient samples, to patients themselves, clinical trial activity, and also juxtaposes scientists and clinicians together all the time to constantly challenge both groups to think of how their research can impact on improving the human condition. I know a lot of people, when they think about why they do science, that's a huge driver. What can I do that's actually going to make a difference to somebody with diabetes, to somebody with leukemia, to somebody with heart disease? And I think this campus provides you with a unique opportunity to look at those sorts of issues. Now, that's not to say that Clayton isn't a fantastic place to do your honours. There are some outstanding research departments at Clayton, but I think it's fair to say that they just lack that clinical perspective, because the majority of people at Clayton are basic scientists. They do great work, but they often don't quite understand how that work can link directly into patient care, and that's certainly an advantage of this site. So I think for those of you who are thinking about translational research as your career path, then you could do no better than come to the AMREP precinct. I think the other thing is, from a career perspective, that the hard reality of science at the moment is that the funding pool is shrinking and it's tougher to get career grants. The success rate last year was around 15 or 16%, and so it's going to be difficult for all of you, obviously, to forge careers as independent research scientists. There's just not enough money to go around. And so, does that mean you abandon a career in science? No, I don't think so. It means you've got to start to think laterally about what else your scientific career could mean to you. And I think there's enormous opportunity in biotech, in pharma, in media, in education, and there's no question that a translational research background helps you enormously in that aspect. So industry, pharma, etc., are looking for people who have some understanding of translational research, what it means to interface between research and clinical care. They're the sorts of people who are going to be prioritised for jobs in that area. Similarly, media want to know and talk to people who understand how research impacts on the human condition. So I think from a career perspective, you could do a lot worse than thinking about exposing yourself to translational type research, because it has a far broader application than just the ability to get NHMRC grants. So the program tonight really highlights this theme. After I've finished this introduction, we'll hear from Professor Jamie Cooper, Jamie, I think, would be regarded clearly as one of Australia's foremost clinician scientists. He has done internationally renowned work published at the highest level in areas of trauma and critical care, and you could not find a more stellar example of how clinical research can be utilised to shape patient care from Jamie. Next, we'll hear from Christoph Hagemeyer down the end there. Christoph works at Baker IDI. Again, Baker IDI very much embedded into understanding both cardiovascular heart disease and diabetes, always looking at the clinical condition, patient care. And Christoph will speak very much about his research and how, although it's more basic, it has translational aspects and why his lab would be a good place to come, as would Baker IDI, but more generally about how that clinical basic science interface occurs, even from somebody who's not a clinician. Next will be Ashley Conway. Ashley is a PhD in my laboratory, so I can promise you that everything she says will be complimentary, otherwise there'll be trouble. So Ashley's going to tell you about the honours experience at the AMREP campus and how she's now gone on to progress into a PhD. And obviously from our perspective, we love you to come and do honours here. We love you even more if you want to do a PhD. And so we'll be certainly pushing that barrow to try and think of going on beyond your honours year to extend your career in science by getting a higher degree with us. And then finally, we'll hear from Associate Professor Mark Wright. Mark has been the honours coordinator on the precinct for many years. He does an absolutely fantastic job at this. He's also a researcher of renown in his own right. And Mark's going to really talk to you about the honours experience, the what's, where's, ifs, hows, etc. And really he's the man to go to if you have any questions about the logistics of doing honours here. So as I said, our whole bent is on translational medicine. We use mouse models, we use basic science, we use patient samples, we use registries, we use epidemiological studies, we use the whole raft of tools. So I think it's safe to say that if you come here, you'll get a broad exposure to many different techniques that lead into translational research. Tonight is really, as I said, about a shop front. It's the Myers windows of research here, if you like, and I really stand here representing all the partners. And the range of disciplines here is quite staggering, I think, be it psychiatry, be it gastroenterology, be it public health. I've mentioned cardiovascular and diabetes, haematology, cancer, infectious diseases. The list is certainly not totally inclusive here, but that gives you a sort of outline of the sorts of departments where you can do research. So a lot of you might have a personal interest in a particular condition, you've had a family member who suffered with something, you know somebody, or just generally a particular area of medicine has captivated your interest and imagination, then I think you will find the ability to work in that area on this precinct almost certainly. So this is the precinct, and fortunately this is the least of the selling points that I have to worry about, because there's no question that the AMREP precinct is in an absolutely glorious position. We have the Paran Market down the road, Chapel Street with unbelievable shopping opportunities, Faulkner Park, Albert Park Lake. I can sell you a house around here, no problem. I mean, it's an absolutely superlative precinct. And I think as an honours student, a bit of it's about quality of life. You know, we don't actually chain you to the bench anymore, and you are free to get around the precinct and so on. And I think there is a great opportunity for a bit of life outside science within the immediate surrounds. And I think, having trained at Monash, I like to think of the Clayton campus and what opportunities that offer, and I think that's probably best summarised here. I mean, take your life in your hands, go across Dandenong Road, visit local warehouses, burnt out cars and so on. So that's really one of our major selling points in addition to our translational focus. So I think there's really compelling reasons to come here from a lifestyle viewpoint as much as anything else. So I like to think of us as from mouse to house. I'm devastated that house has now gone off television because I'll have to think of a new slide to try and convey this message. But it's really, as I said, all about how you go from basic science and animal models and so on into impacting on how patient care is delivered. And I think one thing I really want to emphasise to you is this slide, which is a very busy slide, and don't worry too much about the detail, But 2015 heralds the beginning of the translational PhD course at Monash University. So if you look at the great centres in the US, Stanford, Johns Hopkins, Harvard, they all offer translational PhDs, which essentially have a content of translational coursework, understanding clinical trials, biostats, ethics and so on, and that is a component of a full PhD. This is not on offer in Australia anywhere, and with a lot of work from Stephen Petratos and the school and all our partners, we've developed this program. It's starting next year. So those of you who do honours next year have the opportunity to progress on to this translational PhD, which will give you a unique qualification at Monash University. It will not be a PhD in medicine alone, it will be a PhD in translational medicine. And I think the advantages of this in terms of job prospects, etc., will be substantial. And it's certainly something to have a think about, that if honours is something that you want to do, but you have an eye towards going on to do a PhD, then this is a wonderful forum for you to do a unique branded PhD that's really going to give you a distinct advantage in the marketplace. So without any further ado, again, I thank you all for coming. I know it's a decent schlep down Dandenong Road and in the buses. Enjoy what you're about to hear. Certainly enjoy touring through all the booths and looking at the laboratories. I think that after that there are going to be some tours of the laboratory spaces so you can have an idea of where you're actually working, and I think at the end of the evening you'll have plenty of reasons to give strong consideration to coming here. I'll just make one final point. There has always been a slight suspicion from the students that they're separated from the mothership at Clayton when they come here, and maybe that was true sort of 10 years ago. But we have a huge number of honours students here now, so there's an enormous pool of you at all the institutes. There's an opportunity for association, camaraderie, social interaction and so on. So I don't think this sense of isolation exists anymore. In fact, I think the pool here may well surpass the pool out at Clayton for too much longer, given the level of interest that we've been getting. So welcome, enjoy the night, and hopefully I'll see many of your faces again in the honours cohort next year. And I'll pass you over to Jamie.